it's time for another video recap. This is of our week 2. I wanted to start with the quiz. So here's question number 1 that we're looking at right now. The nurse is caring for a client with Cushing's syndrome. Which of the following nursing interventions apply? This is a nice select all that apply for you guys. And here are our options, so let's go down to the answers. Monitoring for hypotension, no. We want to know that BP is increased in Cushing's, so we're not looking for hypotension. Monitoring blood glucose levels, yes. Cushing's is too much glucocorticoids in the blood, and so our blood sugars are going to go up. So that one was correct. Administering medication in equal doses. No, that wasn't right. Remember how this is a syndrome? You had to watch that language. This is not disease. So we probably caused this with too many medications, so dexamethasone, prednisone. So we would actually be slowly tapering this dose down and not administering it in equal doses. Limiting oral protein intake? Nope, that's not right. And taking measures to protect the client from infection. Yes, we would be doing that. We know that those increased glucocorticoids are increasing this person's risk for infection. You guys did pretty well on this question, so good job. Here's question number 2. Our client has a serum sodium level of 152. What is the normal hormonal response to this condition? When grading the question, here we go. We should know that this is a high sodium level. Our sodium should be at highest 145. So this is high. The correct answer is release of ADH. So we know our sodium is high. So if we release ADH, that's an antidiuretic hormone. So that's going to hold on to our water, right? It's going to stop our kidneys from letting all of our water go, which means we're going to increase the fluid levels, right? We're going to hold on to our water, which will dilute that level of serum sodium and decrease it. So the correct answer was release of ADH. And you guys did pretty well on this one. Okay, this is question number 3. Which of the following would our nurse consider to be abnormal when we're conducting an endocrine assessment on a client? So let's look at our answers here. A weight gain of 1.5 kilograms over the past 6 months. This weight gain is not enough for us to be concerned about any hormonal issues. Hyperpigmented skin colorations to lower legs. Yes, this is possibly Addison's, right? We don't want to see that. Soft form stool every other day, that's fine. Blood pressure at rest, 170, also fine. Excessive facial hair on a woman, yes, definitely. We might be having some Cushing's syndrome here, right? So great job, you guys did good on this one as well. Question number 4, now we're caring for a client who already has hypothyroidism. We know that. What's their diagnosis? Their blood work becomes available and the nurse notices an elevated TSH and a decreased free T4. Based on these results, the nurse knows that the patient's levothyroxine will need to be increased. We know this client is not experiencing toxicity. They don't even have a nice normal free T4. It's too low, right? So it can't be that. The patient's pituitary is not responding to the current medication regimen. Well, it's not the pituitary that responds, it's the hypothalamus, right? So it has nothing really to do with the pituitary, but we have an elevated TSH, so we know the pituitary is actually working. There is a thyroid hormone problem at the hypothalamus level. We know that's not true as well because we do have an elevated TSH, which means we also have TRH going on. The only thing that would be low in this case is the free T4. Okay, so I drew this picture for you guys to know. So what we have here, hypothalamus makes TRH. Remember this from our game? Pituitary makes TSH. So if these are both high, we know they're both working, right? In order for us to have TSH, we have to have TRH. So for this person to have an elevated TSH, we know that the hypothalamus is working as well. What we're missing is the T4, right? So what we don't have is thyroid making T4 and cells using T4, but we do have a blood level drop of free T4. We know that our blood level of T4 was low in this question, which means our hypothalamus would be responding to that, making TRH, and the pituitary is making TSH, which is why the TSH level was high. This was a bit of a tricky question, but the answer is if we see a high TSH with a low free T4, that means we need to increase that person's medication. We already know they have hypothyroidism, but their medications aren't cutting it. They need an increased dose. When we look at our game, so the hypothalamus tossed it to the pituitary, which tossed it to the thyroid, which made T4 and gave it to the cells. And then our cells were happy. They were going crazy, right?
No! Oh, we just trying to catch them all. Just keep jumping. Okay.
So remember when you're studying to think about the actions of the hormones that we are talking about today. There was a lot of opposites today. There was Cushing's, and the opposites of that was Addison's. We also had the opposites with hypothyroidism and hyperthyroidism. Remember to know the meaning of Graves' disease and what that means. And then we also looked at parathyroid, so we had hyperparathyroidism and hypoparathyroidism. And then the last one we looked at was ADH, imbalances in our ADH. We did have the water game for that as well. So remember what that meant. When we had too much ADH, what did that look like? When we had too little ADH, what did that look like? If you guys are able to understand the actions of all the hormones, then you'll be able to understand and predict what's going to look like in a client, okay? Great work today. See you next time.